Hello, and welcome to our conversation today. I want to thank my dear friend, Kennedy Odede, for inviting me to be part of the World Communities Forum and for giving me the honor of helping to moderate our conversation today with three extraordinary women. And before we turn to talking about the fundamental ways in which COVID-19 has disproportionately affected women and girls around the world. I want to give each of these phenomenal women the chance to introduce themselves. You can hear from each of them in their own words about their work with their local communities and with our broader global community. And so I'm just going to go around kind of the boxes on our shared screen as we're in kind of virtual space, but actual community together today. So Adjoa, I just want to ask you, since you're kind of next to me on the screen, if you could kind of introduce yourself and share a little bit about your work with Forward, and also kind of really the extraordinary expansiveness of your work with communities across the globe.
Hello, everyone. As Chelsea has said, my name is Adjoa Kwati Nkluviche. My title is Head of Global Advocacy and Partnerships for the Foundation for Women's Health Research and Development, Forward. Forward is an African women's-led organization. We've been in existence since '85. We registered in '85. And we initially started working focused solely on female genital mutilation. But we quickly realized that it doesn't occur in isolation. And over the years, we've included in our remit child marriage and other forms of violence against women and girls. So that's what Forward does.
Thank you. And Winnie, moving to you again, just sort of going clockwise around the screen. Could you please tell us about kind of an organization that you founded, Teen Seed Africa, and kind of your work with kind of your local community, and also really similar to Adjoa, your broader work as well.
Thank you very much. Hello, everyone. My name is Winnie Obure, and I'm founder and director of Teen Seed Africa. This is a community-based organization that works with adolescent girls and young women on sexual reproductive health issues. We work on economic empowerment and sexual violence, trying to prevent and respond to sexual violence. And I'll tell you just a very small story. So I know a girl who was defiled from the age 10. And the worst of it all was when she was about 15, she got defiled by a very close family friend, and got pregnant, was forced to abort the next year. And this girl dropped out of school because this perpetrator, the defiler, wanted her to continue exchanging sex for her education. And so at Form 3, the third year in high school, she decided this is enough. She can't take it anymore. And she won't pay the price of education with her body. But I'm very happy because today, that girl is me. I went through that, but I don't regret it at all. And like many other girls have been through the same things, I founded Teen Seed as a teen, which is teen and seed, to look at teenagers as seeds of greatness, to look at them as solutions in the community, to be able to rise from the violence and give hope to many other women and girls in our communities. Thank you very much.
Thank you, Winnie. And Bianca, please, you actually have started and been involved in a number of organizations related to women's health and women's rights in Brazil. So could you please share about your work kind of with your local community and again, more broadly?
Yes, thank you very much. I'm a journalist here in Brazil, and I'm a member of UNEAFRO. We offer popular education in 40 different centers in Black and poor communities in Brazil. And when we invite people to learn, they don't learn only Portuguese or mathematics, but also politics and human rights. And we can create possibilities and opportunities together, especially for girls and women. We have a project called Obara, focused on supporting girls in continuing studying, even with the pressure they receive for focusing on domestic work or in the productive work for bringing money home. But in our work, in 12 years, we see many women going to the university, to better jobs, to the Black and feminist movements, and they come back later to teach at UNEAFRO too. So this is a very powerful cycle, and I'm proud to be part of it, of this cycle.
For I think all of us kind of on the screen and probably everyone who is joining us today, we're all aware that or I suspect we're all aware, that while we have been kind of living through the COVID-19 pandemic over the last year, kind of how we've been living through it is heavily dependent on where we live, on the leadership that we have for those of us who are living under Bolsonaro in Brazil, or who were living under Donald Trump in the United States until very recently, kind of the deeply painful consequences of having nationally elected leaders who were dismissive of the virus, dismissive of even derisive toward kind of the basic public health measures to help protect people and save lives. The dismissiveness toward science, towards facts and evidence. We also know that our relative levels of privilege and kind of economic status have deeply correlated to our relative risk of acquiring the virus and our relative likelihood to be able to survive the virus if we do become infected. And yet one of the truisms everywhere in the world is that COVID-19 has fallen most heavily on women, fallen most heavily on women in terms of burden of disease, and fallen most heavily on women in terms of kind of the burden around the burden of disease, the additional child work, the additional homework, the additional kind of caring for those who may be sick with COVID-19 or actually kind of unwell from other reasons and are not able to access the healthcare that they would be not able to do so in non-pandemic times. And so, I know that one of the hopes for this conversation, now that we've heard from, our extraordinary panelists, kind of their backgrounds, is to really give each of them the chance to talk about how COVID-19 has affected women and girls in their communities. And so I want to start there, and then I want to move toward where there are points of optimism and what has been working to help protect women and girls, what has been working to help still empower and support and give agency to women and girls. And yet I think before we can move to that second part, we do have to have some space to hear from all three of you as to what has been the effects of COVID-19 on women and girls in the last year. So Ajwa, again, if we could start with you. So Ajwa, we'll start with you, and then again go to Winnie and Bianca.
Okay. We don't know what the full impact of COVID is yet, but the signs are there. It is clear that COVID has had a huge impact on mental health. That's one of the issues that's coming up. And of course, the mental health of women and girls trying to hold families together, trying to manage looking after elderly, sick, affected family members with long COVID, women who are working in the health industry, because as you know, we find more women working face-to-face in nursing and caring professions. The other thing we do know about COVID is that violence has gone through the roof, and that is in every country. The reports of violence in the homes has been phenomenal, and women who've not been able to get out are still stuck. So we as Forward did a research early on in the pandemic to try to identify some of the issues and what they were, the triggers and the findings. And it was anxiety was the first, fear of your loved ones getting COVID, and the economic burden because people were losing jobs, women also working, low paid, 0-hour contracts, those kind of things. So the impact of COVID definitely has been disproportionately falling on women, and they are bearing the burden. I mean, women never cease to amaze me. We still continue to rise. We'll come back to the issue about the positives maybe later and the opportunities, but that's what we are finding. We're also finding that, and I'm sure Winnie will bear me out, we're hearing stories from Tanzania and Uganda of huge increases in teenage pregnancy because of a lot of child and forced marriages, huge increases in abortions, not properly conducted abortions from Uganda. So we know the lessons from Ebola, and I think we're going to see huge impacts. And I'll stop here.
Well, and Winnie, please, the same question to you as to what kind of you've seen the impact of COVID-19 in your communities and your work in Kenya, especially focused on younger women, on teenagers, the issues that the challenges Adwa you reference, and also the disrupted schooling. I mean, we know that for the 1.7 billion students around the world, it has disrupted almost every student's learning everywhere. And yet we know, again, it's been most disruptive for girls. We know that in many countries, even as schools are reopening, families are keeping their girls at home more frequently. So please, kind of anything that you will share, we very much want to hear, especially kind of what you're seeing the effects are for younger women and girls.
Thank you very much, Chelsea. Like Adwa said, the world haven't seen yet the full impact of COVID-19. They're still in it, and each and every day you keep finding lots of issues, especially at the community level. Like at TIDSEED, we have experienced a lot of sexual violence, especially on the young women and girls. We have many numbers of adolescent girls who are pregnant as a result of this period because they are not going to school. And as we know, school really helps girls to just hide away from perpetrators who see them as sex objects. So we've had a number of them dropping out of school because even when the schools were reopened, most of them didn't go back to school, either because the parents lost their jobs and they weren't able to pay school fee, or they're pregnant, or some of them got married, and so it's very complicated. We have seen so many girls who have come to us and said, I was forced to have sex with someone to buy sanitary towels. We have a lot of the women and young women, especially, who say they had to trade sex with food, because when the curfews came and all the restrictions and the lockdown, you're wondering, how do you lock down people who are living in an informal settlement, really, without clean? We don't even want to go to clean, but water, just water. Without food, they don't have jobs. Most of the women we work with depend on casual jobs. They want to go to Isili or Buruburu to wash clothes. But now, because of COVID, you are able to go to someone's house and you're forced to literally go hungry. So we had a lot of people who were just saying, I just need food. Okay, like I don't know what's coming next. But as a result, so we've had girls who are now even not going to school because they have to be able to finish the journey, which, you're looked at, there's increased stigmatization, right? Because you're a young girl and you're pregnant, all the girls' side and not even on the men who continue to perpetrate these girls. We've had issues like during that lockdown, people who are living with HIV are able to get their medication. The issue of security, women are pregnant and they can't even access a clinic beyond a certain time. And so you wonder, I mean, COVID, they're like essential services, but in the planning, women are not put at the center. So you realize that in most of our needs, or the needs of young women and girls we work with, were not captured in. And so you don't get diapers for the babies, there's no sanitary towels, there's no, you don't have money to even get a taxi to go to hospital at night. And it was embarrassing, that even now in 2021, we're still struggling to get food, something as basic as food, sanitary towels. Yeah. And so a lot of violence also increased because you find, I would say that in the month of April alone, we had more than 15 girls who were just coming to look for safety. They're like, I've been abused either by the dad, the stepfathers, the uncles, or neighbors, and you don't know where to take them because we do not even have enough safe houses in Nairobi. And honestly, the whole of Kenya, we only have one government-run safe house in Makueni County. And so we rely on other women who are opening their doors to support other women who are running for safe survivors of sexual violence. And it's sad because we even had as young as 6 years old girl that was held by the stepdad, and you're wondering, so what happens to this? Among other things that have been also happening at the community level is, we talk about the COVID, and you are expected to wear a mask, you're expected to wash your hands all the time, and you don't even have that money to buy a mask. You do not have water in the first place. The only water you are able to get is a 20-liter jerry can, which you want to use probably to drink or to cook. Yeah, so that has been really crazy. Also, that has led transactional sex to be on the high, with, of course, the risk of HIV and AIDS. I'll stop there.
Oh, Winnie, well, thank you for sharing all of that. As painful as it is, I think it's really important that people hear that. And Bianca, now, turning to you, you mentioned that kind of through UNE Afro Brazil, you work in kind of more than 40 sites. You're also a journalist. You have been involved in other kind of feminist organizations that you've helped, start or kind of worked with. So from these very different kind of complementary perspectives, can you share kind of what you've seen to be the impact of COVID-19 on women and girls in Brazil to be?
Yes. People are hungry here in Brazil, very hungry. And I see a very beautiful communitary organization of women and girls for taking care of all people. So Luana Vieira is a woman, a Black woman of Jardim Miriam in the south zone of São Paulo, and she cooks every day for 200 people for 1 year. And she do this with the communitary support. And also Vanessa Nascimento and Thais Santos, they organize distributing food for many people. And in this year, she has distributed more than 200,000 kilos of food here in São Paulo. So the government has abandoned people for dying here in Brazil. I know you are seeing this in this news. This is terrible because more than 200,000 people have died by COVID here. But people are organized, and at UNEAFRO, girls and women are working in a project called Agentes Populares de Saúde. In resume, popular health agents, girls and women, they are working together with doctors, psychologists, journalists too, because I work with them in this project, and in 5 different places here. And they monitor people with symptoms of COVID. So they register the information about people and call them once, twice, or 3 times a day, depending on the general health conditions, and to helping people in a scientific protocol to be better without a hospital. But when it's extremely necessary to have a hospital. They do political pressure and juridical and communication pressure for people being attending. So they distribute food, thermometer, oximeter, medicines, psychology support for more than 500 people. So the situation is really terrible here. We want to cry every day, all day long, but women and girls are doing what the government, the enterprises, the big organization are not doing. So I'm really proud of our work in this terrible context.
You know, Joy, you spoke earlier about how amazed you've been by women and what women have done. And I think clearly what Bianca just shared is evidence of that. In the absence
indeed.
of political leadership and in the presence actually of, I would say, political violence in Brazil under Bolsonaro's leadership, women have stepped forward to feed our communities, care for our communities. Could you speak about how you have seen kind of similar work through Forward or other organizations that you're engaged in, kind of where there have been not just points of rhetorical optimism, but very much kind of pragmatic optimism because of the ways in which women have organized to help respond to this moment?
I think women were the first to roll their sleeves up and start responding. In terms of organizations like Forward, because we are working closely with communities, we identified the needs very early, especially the needs of the women on the margins, women who are undocumented, who have unstable stay in, for example, the United Kingdom, who were not able to go to work, who were living, on the breadline. We quickly mobilized, worked with partners on the ground, community-based organizations, were able to put in steps to get food to them, vouchers to them, were able to buy data for them to be able to use mobile phones, so on and so forth. And that scenario was replicated all across the United Kingdom. We work with our partners in Tanzania to share information, to share knowledge, to be able to reach out to the community so that communities were able to take steps to protect themselves. And again, this is one example of us working together, because unless we are able to work together, we will not overcome this virus. My real fear is a lot of countries have put huge amounts of money into the COVID response. And I think the austerity that will hit after the vaccines have been, dispersed, to try to recoup that money that they've invested, will hit women and girls even harder. Because for a lot of us who are here in the United Kingdom, for example, we work and we remit money home. And studies have shown that, particularly in the UK, some of the remittances, the World Bank says, is as much as overseas development aid that people here remit home. If jobs are lost, if people are not able to go back to work, if people are suffering the effects of long COVID, then all of this will have a ripple effect on communities at home. So I am actually very concerned, not only with the deaths, the suffering, the mental anguish, the violence now, what happens later. I think that is what I am very much concerned about.
And Joy, I want us to be able to talk about that. And though before we do, I do want to give Winnie the chance to talk about kind of what she, with Teen Seed and other organizations she's working with in Kenya, have been found is possible to help protect girls and women in this time. And I think this is, a really especially important conversation because, as you kind of spoke about earlier, like gender-based violence has exploded everywhere. I mean, it's exploded in the UK, it's exploded in the US, it's exploded across Latin America, across Africa and Asia. And so I think we desperately need to know what can work, so we do know where to invest our time and energies to protect women and girls. And so please, Winnie, I know you are doing some things that thankfully are working to help girls and women who have been hurt and harmed, and also to protect girls and women from hurt and harm. So please, Winnie, anything you can share, we very much welcome.
Sure. Thanks. So what we've been able to do, first of all, is to be able to help our community members to get masks. So like train young women on how they can produce locally made masks from like kitenges, materials like this. Because when it started, one single mask was going for more than $1, which is about 150 Kenyan shillings, and then the price kept going down. So for a woman who doesn't even have food on the table, they haven't gone for the casual, so they don't have money, how do you buy a mask? In fact, it was painful for me in the month of late March and April, where you could not even board a matatu, public transport, without a mask. And so this is a woman who's trying to struggle. She's trying to look for some little money to come and feed their kids, but you will not be allowed into public transport because you don't have a mask. Yet it's very ironical. You're trying to get something to do to support your kids. So what we did was to try and train a few women into how they can be able to make masks for their own and distribute that. We also trained them on how to make soaps, because then the sanitizer was super expensive. Like, you cannot even have that conversation. As making like soap or using jig and other stuff that would help disinfect and also wash hands and be able to just keep living one day at a time. But this was not enough. We will come to you and they need food. Honestly, like, food was a big issue. People were hungry. People are still hungry right now. And so we worked very hard to try and mobilize food staff from well-wishers and philanthropists. Thanks very much to the people who supported and continue to support. We have even seen, not only in Kiabio or by Teen Seed, but a lot of women leaders at grassroots level, including women human rights defenders, running up and down campaigns, collecting food stuff and distributing to the community members. I know amazing other community leaders who were just trying to feed their communities. There's Flora, and I know like Rachel, so many others who have worked very hard to feed their communities. But you see, the more you do that, you realize that just a day meal is not enough. It has to be continuous. We have had women who I have worked with directly opening their doors to accommodate survivors of sexual violence, because you're going to be abused. I mean, security issue is not our issue as women. It's everybody's issue, right? Government must be able to ensure that women are safe at any given time, anywhere, whether you're on the streets or in the bus or in your house. You must be able to run somewhere. Now, we have a government that doesn't have enough funds, doesn't have systems in place in case like a woman is abused, is raped, let's say, or a girl has been defined. Where do they run to? And it's at night. There's curfew that starts at 9 p.m. It was even as early as 7 p.m. And at this time, you're just coming back from hustling, trying to get something. And so we had women that were beaten. Yeah, you're beaten by the cop because the police, you're coming home late and you're wondering, you don't feed me, you don't put food on my table. But, it's continuous violence from all sides. And I a lot of women who came together to just say, I'm opening my door for anybody who needs refuge. You go to safe houses, they're full. Safe houses which are run by individuals, and they're women. So I have seen an immense way in which women have come together to support each other through this pandemic that I've never seen before. I've also lastly seen women, like at Seed, what we do is during this period, we decided to take some of our young mothers back to school. So there's COVID here, but private tuition, because the cycle of violence, we all understand it. And so it means when you're poor, you're not educated, you don't have money, and you don't have a job, it's everything, you have a small child, and then so you keep on going through that cycle without an end. So what we did is get like a space where the young mothers can bring their babies and you do take care for them. We support the young mothers with a stipend so they can be able to go to school and get more education, so that during this COVID, you haven't lost everything. At least you gained something. You gained an education. And I'm very, very glad that this year, some of them have registered for the national education. They're doing the high school education. And that also means that you continue to grow, you continue to build yourself, and also tomorrow is going to be brighter. Lastly is, I have seen, and what we continue to do is taking a few of the girls and young women during this time to train them on basic IT, like this is a computer, this is where you switch on basic skills like how to open up a Google account, an email address. Because what we also saw with COVID is everybody was going tech, all meetings. But you see, it is, as they say with the Sustainable Development Goals, that we shouldn't leave anyone behind. But we have already left a whole bunch of behind. We are in tech. I am very honored right now that I can be on this conversation, that at least I can be here. But there are many, many thousands of young women or even women human rights defenders who cannot afford even internet bundle. They cannot be able to be part of these conversations. Why? In my view, this is discrimination. And this is really an injustice that of all the more than 200 young mothers who are in our program, you'll only find 2 who have smartphones. All the adolescent girls that are in our program, and I'm talking about 150 girls, none of them have access to internet. So tell me, even as a woman, I'm like, no, it doesn't work like this. So we look like we are responding to it. We look like we're doing something. But the truth is, in some of the communities we work, like the informal settlement and some of the rural areas, is women still do not have access to internet. Not even internet, let's start. They don't have access to smartphones. They don't have access to a computer. They do not know how to even operate a computer. So I'm happy that during this period of time, we were able to empower some of them in this, and also open up a place where they can be able to drop their kids and go hustle. So we take care of them, literally, because there's no way you can be able to carry your child, you're hungry, you're trying to look for a job, it's not there, and you get frustrated. And just in addition to what Adwa said, early mental health, you are a survivor of violence, you don't have a job, you're going hungry, you everything is just crumbling, and then you are invited to say a Zoom meeting or an online meeting, and it just looks like a big stone that have been thrown on your face. Like, okay, do I even exist? But I'm very happy for all the programs, all the women leaders, especially the human rights defenders, who stood firm with their community members and mobilized resources, mobilized food to just help them see another day. That still happens even now, and we hope that tomorrow is going to be better.
And Bianca, just listening to Winnie talk about kind of what she hopes will be able to continue as we hopefully move to vaccinate people across the world, and over the next year, hopefully, do that in an equitable and an efficient manner, and are able to kind of move forward from COVID-19. In Brazil, how do you hope, or what do you think has to happen to ensure that girls and women are not an afterthought in recovery from COVID-19, and actually are central, hopefully, to recovery from COVID-19?
Thank you for this question. And for answering this, I'd like to tell you the story of a girl, a Black human, lesbian. She's 23 years old, I think now, called Deborah Diaz. Because telling you about Deborah, I can answer what I see for with hope to the future. And Deborah, she was one student of these centers, these education centers at UNAFRO. And because of this, she went to the university, and now she studies social science. But last year, during pandemics, Deborah was elected as a council woman in a collective mandate. And as you know, Brazil have not Black women in politics. When we have women in this place, you know what happens? Like Marielle Franco, she was murdered. And Black women in politics are also in violence cases. This is really hard for us because we cannot be in this place. And when we are victim of the terrible violences you can imagine. But talking about Deborah, and she is doing a great job with another 2 Black women and 3 men in a collective mandate. In Congress in Brazil, we Black women are less than 200% of all places in the Congress. But women, Black women, we are 25% of the population. Here in São Paulo, the city where I am, we have 50 chairs at the municipal chamber, but only 4 are occupied for Black women. So for us, it's really important to be in our community organizations, but also it's important to occupy another places, in places of power. So Débora Dias, Elaine Mineiro, Samara Sóstenes, they are in the chamber in São Paulo now. They prove us that we can do that it's really hard. But with our communitarian organization, we can give people food, we can teach what's necessary for education, but we can also promote solutions in public policies. For example, we like very much a music called Ya Masemba, and if you can search later, Maria Bethânia is a popular singer in Brazil, and she sings that music. And there's one part that Bethânia sings: I will learn to read, to teach my comrades. Em português is vou aprender a ler para ensinar meus camaradas. So I think this is really important for us. We have to take these difficult times of pandemics for producing this cycle that put young women and girls in different places. Because if we can take care of people in our houses, in our communities, we can do this in all spaces.
Well, thank you so much, Bianca. Clearly, who was elected to office really matters. I mean, we have lived through the last year in which that has been so painfully true, right? Who is in our city councils, our state or our provincial leadership, and certainly who is at the national level really matters. It matters every day. It especially matters, though, in a moment of crisis. I know we only have a couple of minutes left, but Adjo, I do want to return to you because you spoke about your concern that I share, that this kind of time over the last few months, especially around kind of mass vaccination efforts, will be kind of seen as an expense instead of as an investment. And so from your perspective in the United Kingdom and also in the different communities where Forward works, how do you see kind of ensuring that women and girls are central to the recovery efforts in a purposeful sense, and also to avoid unintended consequences?
When I was in school in Ghana, one of our founders, Kweja Agre, was had this saying attributed to him: when you educate a man, you educate an individual. When you educate a woman, you educate a nation. And I think this is very true. If we don't harness the power, the intellect, the passion, the knowledge, the strength of women and girls, we are going to lose out. Not only will we lose out at the community level, we will lose out at the national level and the world level. We all have to work together. And it is imperative that we do this. How are we going to do it? That's a very difficult question. But I think it's about recognizing and acknowledging the worth and the contribution of women and girls, because there are a lot of young women and girls who are also taking action in their own way to turn the world and make the world better. We need to have a vision of a brighter, and Winnie has said it, I've listened to her. Every time she says a better tomorrow, a better tomorrow. And we need to have that collective vision of what that better tomorrow looks like. And that better tomorrow must be about equity and justice. And that must mean equality for everyone. And it means all of us working together to pull ourselves out. It's about being caring, it's about sharing, it's about looking beyond the individual to the whole. Sorry, I'm getting...
No, I agree emphatically. I think it's certainly, and so does Bianca. I think certainly, we have to ensure that women and girls are educated, are protected, are empowered,
supported,
and are given the authorship of the future. Are given kind of the agency in politics, in community organizations, in arts and culture, in front of a classroom or a boardroom. Exactly. And so I certainly hope that for anyone who is joining us, you will be part of that work. And if you want to support the work of these three extraordinary women, I hope that you will reach out to them and to their organizations after our time together to determine how best to do just that. Thank you to our extraordinary panelists. And again, thank you to my dear friend Kennedy for bringing us all together today. And we hope that all of you stay very safe. Thank you very much.